Well, welcome everyone to Lupus You. I appreciate everyone taking the time to join us on a beautiful Saturday morning here in the DC area. We have an exciting program for you and excited to jump in. And Lupus You, it's a free educational series brought to you free of charge from the Lupus Foundation of America. And with everything going on in the last year and a half, typically we'd have a lot of these events in person, but with the pandemic and everything going on, we've actually brought many of these programs virtually online, which has really allowed us to increase the number of people and people from all over the region and even across the country to join these events. So really appreciate you being here this morning. I want to just take a moment to thank our presenting sponsor, Aurinia, and it's with sponsors like Aurinia and like these that we're able to keep these programs, again, free to the public, and I hope you get a lot out of these programs. We'll have an opportunity to ask some questions and also fill out a survey to get some feedback on the program as well. So thank you for being here. And again, we want to, just say thank you to our presenting sponsor, Aurinia. So just a couple housekeeping items real quick. I want to make sure we keep this semi-interactive. I know we have a number of people on the line joining us, some by phone, some on their laptops. Everybody's used to probably at this point being on Zoom and other things, but I want everybody to use the chat function on the webinar. And I have my colleague, Leanna Bennett, here as well. So Leanna, if you're there, you can wave and but put your questions in the chat function. You can interact with each other. You can introduce yourself, where you're from. And we're also going to we are recording. So, at some point we'll be able to post this on our YouTube channel so that people afterwards can have access to it and view it that way. So again, our agenda, excited. We have myself, I'm Zach Feuerherd. I'm the National Development Director, and I'm gonna introduce our speakers, but also just share a little bit about some of the programs that we're doing and executing here at the LFA. I'm also admitting people into our meeting here. And then we have an exciting lineup here. We have Dr. Homa Timlin, who is going to give a lupus nephritis update. We have Dr. Nita Gould, who's going to talk about mindfulness and how that relates to stress and anxiety and how to hopefully cope and manage some of that with lupus. And then we have Christian Harriott, who's a member of the Regional Professional Relations team at Aurinia, to talk about a great program called All In for lupus nephritis. So first, again, I'm going to talk a little bit about some of the programs that we have here at the LFA. And so just so everybody knows, so people affected by lupus here at the LFA are really at the center of what we do. You're the central focus of everything in terms of our mission and our urgency to motivate us to continue this fight. We understand the emotional turmoil, economic hardships, and physical suffering that is caused by lupus. And because of you, we're motivated to work even harder and faster to bring lupus under control so that everyone, this is our vision, can have a life free of lupus. And to put it simply, our goal at the LFA, at the Lupus Foundation of America, is to one day end the impact of lupus and its suffering while ensuring that we provide the comprehensive support and programs for people with lupus that they need. So how do we do this? We have really our whole program is built on 3 pillars. So we have research, care and support services, and advocacy. And we've redefined lupus research to expand our efforts beyond just funding research grants. We're engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this while providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research. So a little bit more about our research program. Our research is patient-centered and focused on transforming lives. We have 3 goals. We call them the 3 C's, and that is to identify the causes of lupus, find better ways to control symptoms, and ultimately find pathways to cure lupus. And to do this, we have to attack lupus from every direction through advocating for sustained lupus research funding, directly funding lupus research that impacts people's lives, and bringing together lupus experts from different areas. So just a little bit more about some of our specific programs. Hopefully everybody has seen, we've sent out some emails. If you're in our database, it's called RAY, which stands for Lupus Research Accelerated by You. And we need your help to advance research in lupus. And you can help advance lupus research right from the comfort of your home by participating in RAY. You can share your experiences with lupus to help inform future clinical trials of new lupus treatments and identify the most pressing needs of people with lupus, because no one understands lupus better than you. And you can compare your experience with others. You can get updates on new lupus research studies. You can share medication and health information with your doctor, and you can help brighten the future for people with lupus. So if you have lupus or you're a caregiver of someone with lupus, I encourage you to learn more about RAY, because I think it's a great tool. And then we have our National Resource Center on Lupus. I can't stress enough what a great resource this is. It's really a nonstop, one-stop source for everything that you need, whether you're newly diagnosed or you're having specific symptoms. It aims to ensure that anyone affected by lupus, including people diagnosed with lupus, caregivers, and healthcare professionals, all have access to high-quality resources that provide emotional support that is clear and is accurate. So again, I encourage everyone to check out that resource center if you have questions. So our health education specialists, these are certified health education specialists who are trained to provide people with lupus, their families and caregivers with non-medical counseling, disease education, and helpful resources. And they can help you find trustworthy information. They can kind of help you navigate if you're looking for maybe a rheumatologist or have questions. It's another great resource. We have 4 health educators now, 2 of which are Spanish speaking and bilingual. And to contact the health educator, you can fill out our online form at lupus.org/health-educator, or you can call them at 1-800-558-0121, extension 136. Again, that's 1-800-558-0121, extension 136. Our Take Charge series is a 12-week education email series for people with lupus, including people that are recently diagnosed. So you sign up, you'll get this great information each week sent to you via email that you can read, you can digest. Again, lots of programs. We have our Expert series, which is a monthly podcast. I don't know about everybody on the line, but I love podcasts. I feel like I listen to a lot of podcasts. But it is our monthly educational podcast where our team interviews experts in the field about topics that are important to you. I think actually Dr. Gould, who's going to be speaking on this presentation, was part of that. And more than 150 support groups across the country. Most of these groups are meeting virtually at this time because of the COVID-19 pandemic. But we are planning, the goal is in FY22 to bring some of those back in person. But again, one of the byproducts of bringing everything virtually and online is we've been able to engage many more people in some of these online support groups. And you can also join Lupus Connect. That is our online support community where members can engage with each other and ask questions. We have, I think, over 3,000 people that are a member of Lupus Connect right now. So it's another great way to connect no matter where you are with other people that are going through similar experiences. And then finally, we have our get involved area. So I think many people here have heard of or have participated in our Walk to End Lupus Now. And that is our signature fundraising campaign event for the LFA. Typically, we'd have 60 in-person walks each year, including one in Baltimore at the Canton Waterfront. The last couple of years in Washington, D.C., we've been on the National Mall, which has been fantastic, and also in Richmond, Virginia. But this year, we're making sure everybody stays safe, at least through 2021. We're going to have a big national celebration on Saturday, October 16th. And if you're interested, you can go to walktoendlupus.org to find out more info. We have our Make Your Mark program, which is really your do-it-yourself. If you're passionate about something and want to raise money for the LFA, you can make your mark for lupus. And then maybe even most importantly, you can become an advocate. Your voice is one of the most powerful tools that we have. We're the leader in stimulating federal support for lupus, and we've generated over $615 million in lupus research and education in the past 5 years just through your advocacy efforts. So those are just a few ways that you can get involved. And of course, I think everybody here is probably involved locally in some capacity in the DC area. So you can go to lupus.org/chapters. And then again, I'm going to send out all of these slides afterwards, and this will be in the recording, but these are just some contact information, our main phone number, our main email. And if you're on social media, whether it's Facebook or Twitter or Instagram, I would say that's probably the quickest way, even at this point, to get updates and the most quickly get the most information from us. So, follow us on Facebook, follow us on Twitter, and that's going to be the quickest way for you to get that information. So again, we will send these out. My name is Zach Fearherd. I'm the National Development Director, and I'm excited to introduce our next speaker. She is going to give a lupus nephritis update. And Dr. Timlin is a physician at the Johns Hopkins University School of Medicine. Her areas of clinical expertise include systematic lupus erythematosus and lupus nephritis. Dr. Timlin also serves on the faculty of the Johns Hopkins Consultative Rheumatology Clinic. And today she's going to be discussing lupus nephritis. So Dr. Timlin, excited to have you present.
Thank you so much, Zach, for the introduction. Do I have to control to?
Yeah, I'm going to make you. Okay, great. Just made you the co-host, so you should be able to share your screen there.
Oh. Sorry, go back to slide 1. Can everyone see my screen?
I don't see it yet.
You can't?
Well, I'm happy to pull them up, Dr. Timlin, if you want to just, whenever you want to go to the next slide, I can advance it.
I think I need to, okay, there you are. Okay. Oh. Can you see now?
Yes, perfect.
Excellent, very good. Thank you so much, Zach, for the introduction. Before I start my talk, I just wanted to remind you about the CDC guidelines. As you know, CDC always recommends everyday preventive actions to help prevent the spread of the disease. So you should use masks, practice social distancing, wash your hands, and self-monitor, and continue to follow the CDC website for any updates. I have no disclosures, but I will be discussing some of the medication that we have been using for patients with lupus nephritis. So what is lupus? Remember, lupus is not an infection. Lupus is an autoimmune disease. When your immune system attacks your body, causing a range of symptoms, they can be variable, benign, or life-threatening. Lupus may affect one or more parts of the body: joints, skin, lungs, heart, kidneys, muscles, and brain. Monitoring symptoms should be a team effort. Good communication is essential to ensure that you get the support you need. So it starts from you, your rheumatologist, and other specialists, in addition to the regular monitoring and visits. There are two kidneys, both connected to the bladder via this called ureters. Kidneys filter blood to clean out waste products. They remove excess water and regulate fluid balance. They balance electrolytes such as sodium and potassium. And they play a role in hormone regulation such as vitamin D. So this is how the kidney would look like inside the kidney. When the unfiltered blood comes to the kidney, they go to this called nephron. Nephrons are the functional units of the kidneys, consisting of a glomerulus and a tubule that actually produces urine in the process of removing waste products from the blood. Remember, each kidney contains 1 million nephrons. So each kidney contains 1 million nephrons. So once the unfiltered blood comes to the glomerulus, gets filtered, filtered blood goes back to the body, and the waste products comes out in this tubule as urine. So what is lupus nephritis? It's the inflammation in the glomeruli of the kidney causing leakage within the blood vessels. As a result, the kidneys become less effective at filtering blood. It is important to remember that every time there is a flare of lupus nephritis, 1/3 of nephrons will be gone. So 1/3 of nephrons will be gone, and that's permanent scarring. What are the symptoms of lupus nephritis? None to severe. Patients can develop swelling in the legs by retaining fluids, or foamy urine, or blood in the urine, or elevated blood pressure. So it is important you get evaluated. We look at the vitals, looking at the blood pressure, examine joints for any swelling, any lupus-related rash, listen to the lungs for any fluid in the lungs, checking legs for any fluid in the legs. We then request further testing, such as CBC to look for anemia, check kidney function tests, as well as lupus labs like double-stranded DNA, complements. Also, very important to check urine tests to look for blood or protein. So the kidney biopsy is gold standard for diagnosis. It's done by nephrologists as low risk, is either ultrasound or CT guided. So the biopsy is very important. The color changes on the biopsy reflects amount of cell deposited in glomeruli of the kidney. There are 6 classes of lupus nephritis. So remember, there are 6 classes of lupus nephritis. Class 1 and 2 are mild. Class 3 is focal glomerulonephritis. Class 4 is diffuse glomerulonephritis. Class 5 is called membranous glomerulonephritis. And class 6 is basically scarring. At this stage, patients will require dialysis and will be referred to the transplant team. So this is how the biopsy would look like under the microscope. So you see class 1, class 2, class 3, class 4, and class 5. As you see, the increased color means increased inflammation. How do we treat lupus nephritis? So it really depends on the biopsy and severity of the disease. We consider short-term treatment called induction or long-term treatment called maintenance for a total about 2 to 3 years. The very first medication every lupus patient should be taking is hydroxychloroquine unless there is a contraindication. Hydroxychloroquine is very, very important. It reduces flares, reduces organ damage, reduces lipids, reduces thrombosis, reduces seizures, triples mycophenolate response, and is the only medication that has been proven to increase survival. So it is very, very important to take this medication, and only works if you take it regularly. Steroids we use steroids for class 3, 4, and 5 lupus nephritis. They're given either through intravenously called methylprednisone or by tablets called prednisone. They work the fastest. They can suppress adrenal glands. So it is very, very important that we should never stop this medication without discussing with your rheumatologist. Steroids have lots of side effects. They can increase infections, osteoporosis, thinning of the bones, thinning of the skin, osteonecrosis. They can cause diabetes, high blood pressure, cataract, glaucoma. So for that reason, we always use steroid-sparing drug. Such as mycophenolate. So mycophenolate has been used for class 3, 4, and 5 lupus nephritis. It requires regular blood monitoring, and it must not be used during pregnancy because it causes fetal malformation. It is also useful for other manifestations of lupus besides kidneys. Another medication similar to mycophenolate is called Immuran or azathioprine. This medication can be given throughout the pregnancies. Similarly to mycophenolate, requires regular blood testing. So it can affect cell counts and also liver function. Other pills include cyclosporine. They can cause swollen gums or elevated blood pressure. Another medication called tacrolimus, which we do use either alone or in combination with mycophenolate. We now rarely use Cytoxan. It's given 2 different regimens, like intravenously or tablets, either using NIH protocol, which is every 4 weeks, or Eurolupus protocol, which is every 2 weeks. Cytoxan has lots of side effects, a lot of GI upsets, such as nausea. It can increase risk of bladder cancer and premature ovarian failure and fetal malformation. Retoximab is another medication that is given intravenously, either every 4 weeks or 2 doses every 2 weeks. Patients can continue hydroxychloroquine and mycophenolate, and in rare cases, it can be used followed by Benlysta. It increases risk of infections and infusion reaction. So remember, when you go for the infusion, make sure you are accompanied by a member of family or friends. I'm so pleased this year we have 2 new medications that have been FDA approved for lupus nephritis within a couple of weeks. We had first Benlysta, which was FDA approved in December 2020. It's an injection, either subcutaneously or intravenously. And a few weeks later, Lupus kinase or voclosporin was FDA approved. This medication is taken by just tablet. There is no injection. Clinical trials are ongoing, so I'm hoping by next year we will have new medications for lupus to treat lupus nephritis. In addition to the immunomodulatory, that's hydroxychloroquine, immunosuppressant medications such as mycophenolate, Immuran, and what I just discussed, we also use other medication like vitamin D. So it is important that you make sure your rheumatologist does check your vitamin D. Controlling blood pressure is critical in kidney disease. So some of the medication can reduce protein loss from kidneys, and they also help with the blood pressure, and some of them called like lisinopril, losartan, other medication being used to lower the cholesterol or bone protection. And remember, lupus nephritis must avoid medications such as ibuprofen, which is over the counter, naproxen, or other medications that are prescribed by different physicians like meloxicam, diclofenac. As I just mentioned earlier, there are lots of resources on Lupus Foundation of America that you can search. Now, I'm going to ask you questions. You can just reply or turn on the microphone and answer as we go. I just want to see who was listening. So as you know, nephrons are the functional units of the kidneys, consisting of a glomerulus and a tubule that actually produces urine in the process of removing waste products from the blood. Approximately how many nephrons does each kidney contain? You can even answer through chat if you like. Very good, 1 million. What's the most important medication that all lupus patients should take unless there is a contraindication?
The steroid.
What's the most important medication that all lupus patients should take unless there is a contraindication?
Yeah, it is the Plaquenil. She's right.
Plaquenil, very good, excellent. Hydroxychloroquine. How many classes of lupus nephritis are there?
6.
Excellent. What are the 2 FDA-approved drugs for lupus nephritis? So the first one is the injection called?
Benlysta.
Very good. Or belimumab. And a few weeks later, another medication was FDA-approved called?
Retoximab.
Lupus kinase, voclosporin. So Christian will be talking about this in a few minutes. Thank you so much.
Great. Thank you so much, Dr. Timlin. And yeah, it's always good to keep people on their toes and do a little trivia there. We did have a question. I think it's fabulous. I've been here at the Lupus Foundation almost 8 years, and to have different therapies be FDA approved in such a short period of time is just really, really exciting. And so we did have a question in the chat, and I feel like this is kind of a broad question, but it says, although research is being done and money is being raised, what is the latest that we have heard in terms of a cure for lupus? So do you get that question in your clinic a lot, or what is your response to that?
So that is a very common question. We hear that all the time. Remember, as I said earlier, lupus is an autoimmune disease. It's not an infection. So with infection, you get antibiotics, for example, it's treated. What with autoimmune disease is to control the disease. So there is no cure, but there are medications to control the disease. And they only work if you take them regularly. So it's important to take, and especially the very first medication, as I mentioned earlier, hydroxychloroquine.
Any other questions for Dr. Timlin? You can put it in the chat, or if you'd like to unmute yourself, we have. Okay. I'm going to get us to our next slide.
I think there are some questions here. No? Okay.
Okay. Well, thank you again, Dr. Timlin, and we can circle back in the chat if there's additional questions at the end too. But I'm excited to introduce our next speaker. Dr. Nita Gould is a clinical psychologist and assistant professor of psychiatry and behavioral sciences at the Johns Hopkins University School of Medicine. She also serves as the associate director of the Anxiety Disorders Clinic at Johns Hopkins, Bayview Medical Center. Her areas of clinical expertise include anxiety disorders and depression. Today, she will be discussing how to cope with stress using mindfulness, and will also lead you in a guided sitting practice, and really specifically as it relates to lupus as well. So very excited to introduce Dr. Nita Gould. Dr. Gould, the floor is yours. I can navigate here, or I can turn over controls to you.
Thanks, Zach. Yeah, if you wouldn't mind making me co-host, that would be great.
Sure.
Thank you for the introduction. Thank you, Dr. Timlin, for the wonderful slides and lecture. And Zach, just to confirm, I'm stopping at 10:50. Is that right? About 10:50.
Yeah, that'd be great. Or we're kind of ahead of schedule, so whichever time you need is.
Okay.
Yeah.
Sounds great. Okay. So let me share my screen. We'll probably do a very brief practice. I'm going to run through these slides, and then we'll do a short practice at the end. Can everyone see that?
Yes.
Okay, perfect. All right. So I'm going to talk to you today about mindfulness or mindfulness meditation. And this can be a tool that can be incredibly helpful for stress in general, and certainly as it relates to lupus. And I'm going to talk with you about what this is, about some of the research findings, and then guide you through a brief practice. So mindfulness is a term you've probably heard. Basically, it's bringing your attention to the present moment. So we're bringing attention to the present moment on purpose, but with a particular attitude. So one that's non-judgmental and curious, as opposed to judging something as I like this or I don't like this. So we're beginning to turn towards experiences in mindfulness. The opposite of being mindful is being on autopilot. So this is when we're mindless. You might think of your own examples. A lot of people say when they're driving, when they're eating, when they're doing the dishes. So these are times when we're engaged in activity, but our thoughts are elsewhere. And this can lead to distress. So we miss out on the activity we're engaged in. And also our thoughts go all over the place. And especially if you're in a period of stress, your mind tends to latch on to that stress. So when can we practice mindfulness? Theoretically, in every moment we can be mindful. It's not going to happen, but it is a possibility. But there are two ways to build the muscle of mindfulness, so to speak. One is to practice formal mindfulness, where like we're going to do at the end of this lecture. We'll spend a few minutes bringing attention to different aspects of the present moment. And then informally noticing when you tend to be on autopilot and starting to bring awareness to those activities. So I often encourage people to pick one routine activity this week, taking a shower, washing your hands, walking, driving, whatever it may be, and see if you can be mindful, aware during that time of your senses and see what that's like. So why should we practice this thing called mindfulness? This is a really growing area of research. We know that there are lots of benefits to practicing mindfulness. The most robust benefits in the research are in the areas of anxiety and depression. So we see decreases in anxiety and depression across clinical and non-clinical populations. And we see decreases in pain severity, pain disability. And these other areas, we've also seen really interesting changes, improved immune function, decreased blood pressure. The findings aren't quite as robust and consistent as we've seen in the areas highlighted in yellow. We do see changes in the brain, though, following mindfulness meditation practice, regular mindfulness meditation practice. And these, anytime you learn something new, your brain does change. I'm going to talk a little bit about how mindfulness meditation as a regular practice can change the brain. So I've highlighted some of the areas involved in mindfulness meditation. This is, imagine that your eyes would be right here. And so if we took, and this is the back of your head, so if we sliced your brain in half, this is what we would see. We have the frontal lobes, our executive functioning skills. These are the skills that make us smarter than all the other animals, where we can reason and have abstract thinking. This area involved emotional regulation, the insula involved in self-awareness, and the amygdala involved in the fight or flight response. So the amygdala is the part of the brain that turns on when we're confronted with a real or perceived stressor. And what happens is it starts a cascade of events that gets us ready to fight, flee, or freeze in a situation. Nowadays, this system might turn on and there may not be an actual threat. It might be a social threat, or it might be a thought that we have that turns on the stress response. And these are places where mindfulness can be helpful as a tool to manage that stress. By the way, I won't be giving you a quiz at the end, so don't worry about these terms, although I may start doing that in the future. So it's a good way to see if people are paying attention. So long-term meditators, we know, have derived a lot of benefit from doing meditation, and in terms of their brain structure and function, we see changes. But what we know is that now more recent research shows that even after 8 weeks of regular and consistent mindfulness practice, this mindfulness-based stress reduction course is an example. I'll talk more about that in a moment. We see brain changes similar to long-term meditators. And what are some of those changes? Well, according to this review article, we see increased activity in that prefrontal cortex, the area of the brain that allows us to make decisions, kind of abstract and complicated thinking. We see positive changes in the hippocampus, the part of the brain involved in memory formation, as well as areas of self-awareness, emotional regulation. And then that part of the brain that I said turns on with the fight or flight response, the stress response, we see decreased activity there and earlier deactivation to emotional stimuli, which means that if you are confronted with a stressful event and it's not life-threatening, or it's not damaging to your physical integrity, you're not about to get hit by a car, for example, then that area of the brain turns off more readily. Surprisingly, there are very few research studies that look at mindfulness-based interventions for lupus patients. So this, a note to myself and Dr. Timlin, that's something that we can talk more about and see, how we could study this. There are 3 studies that I came across. One is mindfulness-based cognitive therapy. And what this showed was an improvement in anxiety and depression, as well as in quality of life in patients with lupus. Another study in Korean patients showed improvements again in anxiety and depression. So again, this is consistent with some of the other findings where we're seeing across clinical populations improvements in anxiety and depression. These studies have not shown changes in disease activity, but they're also small studies with limited sample sizes. And so it would be really interesting to study that and see if we do see changes there. And then this last study that showed following a mindfulness-based group therapy, there was more acceptance of the disease, more ability to distinguish from oneself from the disease. Perhaps the most well-studied course is this mindfulness-based stress reduction course. And interestingly enough, I did not come across a single study using this course in lupus patients. This is a course that I teach, and I'll talk a little bit more about the details. It's an 8-week course where we meet for 2.5 hours each week, a full day silent retreat, and then home practice with guided meditations. It has been virtual since the start of the pandemic, so now I am teaching it virtually, and I've modified it because 2.5 hours is a really long time to sit behind a computer. So it's 1.5 hours for 8 weeks, and then a half-day silent retreat, and still the home practice with guided meditations. It's in a group setting, but it's not your traditional group psychotherapy. It's very skills-based. We do a variety of practices in the course, including various meditations, breathing meditations, sitting meditations, some very gentle yoga. Now that it's virtual, it's more just some stretching, and then ways to bring mindfulness to daily life. And as I mentioned, a silent retreat. So how can you start to incorporate mindfulness into your day? You may choose to take a course such as the mindfulness-based stress reduction course at some point. That's fine. But even today, you can begin to incorporate mindfulness into your day. You can pause and take a few deep breaths. You can do this randomly. You can do this at set times. You can do this when you start to notice you're getting stressed. And these are little mini ways to reset the stress response. Bringing attention to your senses. So our senses are always in the present moment. So if you can pause and note your senses, then you ground yourself back into the moment. And you distance yourself from the thoughts that can spiral, that can be stressful, that can add distress to an already challenging situation. Pausing, so we see a lot of pausing in mindfulness practice, pausing before transitioning to a new task. Pausing, if you can, before you pick up your phone. So we pick up our phone, hundreds of times a day, I suspect, and it's not always a pleasant thing we encounter when we pick up our phone. So you might get a text, you might get on Facebook, you might get on some other social media, and it's not always making our mood improve. And so just being, for example, just social media in and of itself, you get on and everyone's life seems better for some reason. We know that's not an accurate representation, but we can very easily get sucked into that. So pause before picking up your phone. Labeling how you're feeling. So if you can, we have a saying as psychologists, if you can name it, you can tame it. So just identifying how you're feeling, even if it's unpleasant. So sadness, anger, irritable, whatever it is, you can begin to temper some of those feelings. Catching yourself again when you're on autopilot, and then having some form of reminder. Maybe you have put it on your calendar that I'm going to meditate for 5 minutes today, or every time before you eat lunch or whatever it may be, just so you can remind yourself. Like I mentioned, you can bring mindfulness to daily activities. For example, you can eat mindfully. You could practice this today and see what it's like, just to put everything aside, really slow down, put your fork down between bites and kind of savor the food and have gratitude for this experience. When you are confronted with a stressor, just take a moment to state the facts of that stressor. So I'm running late, for example, or the Zoom link isn't working. And then notice all the add-on thoughts that accompany that. So what if I can't get on the Zoom? What if I miss this lecture? Or what if I miss this appointment? And just see if you can come back to the facts. So I'm running late, or I can't log on. So that's already stressful enough, but then we kind of go down this rabbit hole that really can exacerbate our distress. There are lots of resources out there. So you can, if you just Google mindfulness meditation practices, a lot of things will come up. These two websites, UCLA, UCSD, they both have mindful awareness research centers. So they're not actually, I don't have the websites here, but if you just Google those, you'll see. And I'm happy to share these slides in some way if it's possible, but you can also just take a picture of this with your phone if you'd like. There are lots of apps. Some really popular ones are Calm and Headspace. They have portions that are free, and then if you want a full subscription, then you have to pay. Insight Timer is a free app, which has thousands of meditations. That's a nice app, so you could try that one. I also recently developed this with a colleague and actually forgot about it. And so Dr. Timlin, I don't think I've even talked to you about this, because I just remembered yesterday that a few months ago with another colleague, we put together this website. She spearheaded this, Dr. Dorenzo, and she basically, we have a bunch of recordings, mindfulness recordings and background and resources, so that for rheumatology patients in general. So you can check that out. So it's mindfulness.hopkinsrheumatology.org. I lead live mindfulness sessions on Wednesdays. You're more than welcome to come to those. They're 30-minute sessions at noon. This is the Zoom link. Again, happy to share these slides so that you don't have to jot down all this information. And I mentioned that mindfulness-based stress reduction course. If that's something that interests you, please feel free to email me. I'll add you to my list. I have the groups running about every couple of months. They are virtual now. You can email me. I can also put in the chat our clinic number if that's an easier way for you to contact us. You do have to be in Maryland. So because I'm only licensed in Maryland, you do have to be physically located in Maryland for me to have you in this group. But if you're not in Maryland, there are lots of mindfulness-based stress reduction groups that are offered nationally and internationally. So you can Google those and they will come up. So let's see. So Zach, it's okay if I have like do a 5-minute practice and end in 5 minutes?
Yeah, please do. That'd be great.
Okay. So I want to guide you through just a brief practice, just so you can get a sense of what mindfulness is. And if you'd like to participate, you don't have to do anything special. You can just find a comfortable position for yourself, one in which you feel alert and awake, but most importantly, comfortable. I'll invite you to close your eyes. And let's take a few deep breaths together. A deep breath in, a long, slow exhalation. Another deep breath in when you're ready. And a long, slow exhalation. And one more time, deep breath in. And slowly letting go. Letting go, letting go. You can return your breathing back to its normal rhythm. And in this practice, we're not trying to change anything. We're just noticing what's here. I'll guide you through this. And we're making some space for our experiences, even if they're not the way we'd like them to be. We're just kind of turning towards them with an attitude of acceptance and openness. So to start, just sensing your body sitting here, sensing places your body's coming into contact with the chair or whatever's supporting you. And sensing your feet coming into contact with the floor. Noticing sensations in the hands. And just sensing how the body feels in general today, tense or relaxed, comfortable or uncomfortable, without making your experience wrong in any way. And now take a moment to notice sounds around you. Sounds nearby and sounds farther away. Noticing the spaces between sounds, the spaces of silence. Turning inward again and just checking in with how you're feeling emotionally in this moment. Just ask yourself, how am I feeling right now? Again, without making it wrong, without a need to change how you're feeling, and without adding a story to your experience. Just a brief note how you're feeling right now. And then finally returning back to the breath. And for the next few breath cycles, just being present with each in-breath and each out-breath. When you're ready, you can slowly open your eyes. Take a moment to stretch out if you'd like. So if you've never meditated before, congratulations. You can check that off your list, although it is a lifelong process. So it's like going to the gym or doing anything else. You need to practice it continuously. But this was an introduction. So thank you so much for tuning in.
Oh, thank you so much, Dr. Gould. I think your slides here, I wrote down, the 3-breath break and the pausing and, even just pausing before you pick up your phone. And, I think these are all practical tips that everybody hopefully can walk away with. And, you know, as we know, life is or can be stressful in normal times, and with everything going on, I think it's, you know, ever more important. So thank you so much for sharing that.
My pleasure. Thank you.
Any questions? I had a couple additional questions to circle back with for Dr. Timlin before we get to our next presenter, but any questions in the chat for Dr. Gould?
And I am putting our clinic number in here if people prefer to use that as opposed to the email.
Okay, perfect. Well, Dr. Timlin, I had just a couple questions that came up in the chat. The first one was, what are usually the first signs of lupus?
So lupus, as I mentioned earlier, you can have no signs. So at the beginning, or severe. So it's mild, moderate, or severe. And for that reason, it's very important that you have regular monitoring. So your physician would check for any leg swelling that is persistent, not the swelling that you get like during the summertime, during heat, comes and goes. So not everything is related to lupus, but it's very important that your rheumatologist does see you on a regular basis, examine you, and does the regular labs to see if there is anything active. So remember, not everything is related to lupus, but it's important to be evaluated because lupus is not an autoimmune disease that will be cured on its own.
Okay, great. And then second question, when I get flare-ups, it usually leaves scarring. What can I do to eliminate the scars?
So scars means irreversible tissue damage, right? And what is the goal is to prevent flares. So preventing flares, again, we're going back to number one, self-monitoring, seeing your rheumatologist, regular physical exam, lab monitoring, and taking the medications as prescribed. Because if you don't take the medication thinking your lupus is cured, you're going to have a severe flare. And every time when there is a flare in the kidneys, you will lose 1/3 of the nephrons. So the goal is not to have a flare, and the only way it can be done by regular monitoring and taking the medications as prescribed.
Mm-hmm. And can you speak briefly on how long the legs swell to be nephritis?
So the swelling in the legs that we are referring to is called pitting edema. You will see the indentation. And this is kind of quite severe form of lupus that you would see the leg swelling. And a lot of patients, they end up being hospitalized because there's severe inflammation in the kidneys. So it is, again, it's very important to see your primary doctor or rheumatologist so they can evaluate, see what's the cause of leg swelling. There are so many causes for leg swelling. So not everything is related to lupus. And when it comes to lupus, it's very important to be evaluated.
And then finally, if you have cysts on your kidneys, do they take up space that is usually used for filtering?
I just replied to Ms. Holmes about cyst. So cyst is completely different pathology. It's not lupus nephritis. So they can be different sizes. They can stay there for a long time. And the treatment is completely different. It's not like lupus nephritis where there's a lot of inflammation that we need to treat aggressively.
Okay. And then we actually did just get one more, and then we'll go to our last presenter. Is it true that sun exposure can affect or cause a lupus outbreak or flare, regardless of the type of lupus you may have?
That is very true. So it is important that lupus patients avoid sun exposure. Sun is not your friend. So remember, I always tell my patients, sun is not your friend. So when you go outside, make sure you wear SPF 100, cover up. There is hat with a big brim, long sleeves. So you really need to avoid the sun as much as we can.
Okay, great. All right, well, thank you, Dr. Timlin, and we're getting some great comments in the chat section about Dr. Gould's presentation and some experiences with Dr. Gould and her program. So again, thank you. Okay. Our next presenter is a regional professional relations team member at Aurinia Pharmaceuticals, and excited for him to share some great resources. And the program is called All In for Lupus Nephritis. So I'm excited to welcome Christian Harriott to the program to present. And Christian, I can make you co-host, or I can share the slides, whichever you feel comfortable with.
You can make me co-host. No, pull up the slides. You can pull up the slides. I think that's what we talked about earlier. So just
okay, perfect.
Pull them up, and I'll give you a little cue to keep it going.
Sounds great. Sounds great.
Because I'm in mindfulness now, and I don't stress over anything. Okay.
Exactly.
Okay, so I'm doing great. Okay.
Sounds great. Well, here we go, Christian. The floor is yours, and
okay.
Hopefully everyone can see my screen.
All right. Do you? You know what? Why don't you share with me so I can pull it up in a PowerPoint format versus the PDF format? Is that okay with you?
Sure. Okay, I'm going to make you co-host, and then you can pull it up on your screen.
Okay, great. All right. Let's see here. One quick second here. Are you sharing with me now? Let me see. I can share my screen now.
Yes, you should be able to.
All right. There we go. Share that. Okay. From the beginning. Well, good morning to everyone. Hold on a second. From the beginning, there we go. Good morning, everyone. I'm Christian. Again, I'm in a mindfulness mode, so I'm quite pleased and breathing quite easily. And I'm from Aurinia, and we're going to talk about the All In program for lupus nephritis. And again, it's a unique program sponsored by Aurinia. And the question is, why do we need to create a disease awareness program for lupus nephritis? Because lupus is a serious disease. It's chronic. It has many complications, as Dr. Timlin went through with SLE. It's the body attacking the healthy cells, and it causes inflammation that impacts most parts of the body: joints, skin, brain, heart, lungs, and kidneys. But when it affects the kidneys, it's a lupus nephritis. And Dr. Timlin gave us wonderful, information on that, and the fact that in the lupus nephritis community, 50% of those patients go on to develop lupus nephritis. And so, it's a common complication, involves inflammation. I'm not going to repeat much of the stuff that Dr. Timlin spoke to. So the question is, what is the All In program? The All In program is, and pull up my notes so I can make sure I'm complete with everything, is an educational and support awareness program that's focused on diagnosis of lupus nephritis and support for those people living with lupus nephritis, and most importantly, empowerment and support of people affected by lupus nephritis through information, tools, and resources. So from the name of the program, All In, it's developed content, resources, using feedback from you, the lupus community, and the insights provided directly from the lupus nephritis community. All the people in the All In website and education materials are people that are actually living with lupus nephritis and their care partners. The All In program offers a website with information about signs, symptoms of lupus nephritis, diagnosis of the disease, tips for managing lupus nephritis once diagnosed, and you can hear directly from those people who are living with the condition, who will share their personal journeys, including challenges and triumphs from the support, in the community support videos and personal stories section. I'm not going to pull up that. I will share the link later on, and I'll put it in the chat box, but there are community support videos, and you'll hear from personal stories with people with lupus nephritis. So the question is now, what's in the all-in toolkit? And the toolkit was developed specifically for the support and guidance and all the informational resources for people impacted by lupus nephritis. There's a glossary of terms. There's a USB drive, okay, that's included in the kit. There's a glossary of the lupus nephritis terms. There's a frequently asked questions about lupus nephritis in case we have to go back and refer to something. It's questions to ask your doctor before your appointments, things that you may want to inquire about and prepare so that the visit goes smoothly and you get all of your questions answered. How to talk with your family and friends about lupus nephritis, and also caring for somebody with lupus nephritis, support system and care guidance for those who are helping support the patients with lupus nephritis. And there's a sample employer or school letter that helps describe people living with lupus nephritis and their care partner when referring somebody to the employer or school about it, and considerations for creating a healthy working environment and learning environment for those people. Now, the one thing I will say is, again, please join the All-In community, because it'll help you feel informed and supported every step of the way. You can visit the website and allinforln.com. Check us out on Facebook. That's a common phrase nowadays, but check us out on Facebook, and just go in and register. I'm going to pull up that didn't mean to do that, but it's a registration link, and just register. Stay connected. Get informed. Learn about your condition. And that's what we ask. That's all we ask. Okay. Let's see. And with that, if there's any questions, we have an all-in support program that helps patients, and there's many resources that we offer. And we just thank you for the opportunity, Zach, to participate and share that. And if anybody has any questions, please do not hesitate to ask. And we thank you all again for this opportunity to share.
Yeah, thank you, Christian. And again, I encourage everyone to visit those links. We can certainly follow up with everybody that's here today and registered. Some great resources, the toolkit that Christian mentioned, and Aurinia, Christian, everyone's just a great partner as well. So encourage everyone to do that. Again, lots of great resources offered today, both on the lupus.org website, some links that Dr. Timlin included and Dr. Gould as well. But I'll just pause a moment. If there's any questions for Christian, we can put those in the chat.
All right. Okay. If anybody has any questions, Zach has my contact information. I'll also put it in the chat box. And if there's any questions that can be answered, I'll be glad to provide an answer for you.
Perfect. Yeah, thank you. Thank you. And so we are coming to the end here. Again, I appreciate everyone's time here joining on a Saturday morning. I want to especially thank our presenters, Dr. Timlin, Dr. Gould, Christian. We definitely want to get your feedback. We're always trying to improve these programs. Again, over the past year, we've done all of these virtually. And so there's a link to a survey. We'll send this out in a post-event email as well. But if you have your phones out, you can also, I know QR codes are making a comeback here in the pandemic, but you can put your phone, you can take a picture of the QR code, and that'll bring up the survey. So again, we'd really appreciate your feedback to improve these programs. So again, we will follow up. We'll eventually have a recording, and we just really appreciate everyone's time. And if there's no other questions, I'll just double check the chat here. I think we are good. So again, I want to thank everyone, and we will see you soon with our next program. Okay, have a great rest of your weekend. Thank you, everyone.